Perfect. Good morning, everyone, and welcome to this session of the World Data Forum. And I'd like to thank my speakers, the participants and speakers, and that I will introduce in a minute. This session is entitled "Household: The COVID-19 Crisis is Household Survey at a Crossroads." The session is organized by the Intersecretariat Working Group on Household Surveys, with members from 10 agencies and 8 member states, created for better coordination and advancement of survey methodologies. Household surveys remain an invaluable source for SDGs monitoring. A recent mapping of exercise showed that around 1/3 of all SDGs indicators, 80 out of 232 indicators, can be sourced from household surveys. The COVID-19 crisis has presented a major challenge for household survey programs in countries. In May, a survey showed that 96% of national statistical offices partially or fully stopped face-to-face data collection at the height of the pandemic. In response to the government's requirements on social distancing, many national statistical offices have quickly turned to different data collection modes, whether it is telephone or web interviews, in order to maintain data continuity. At UN Women, similar to other agencies supporting household surveys globally, many of our operations were disrupted by the pandemic. But at the same time, the need for timely data for both our partners and our organization was real and urgent. So among other actions, we started supporting a number of rapid assessment surveys. And we've conducted 40 to date, and another 30 or so are planned or either planned or underway. We will hear one such example from Maldives shortly. However, as countries start to relax measures, our previously planned survey operations are resuming. And there are lots of questions that arise, particularly after the recent experience with phone or web-based surveys. And as importantly, as we have seen in many countries now, COVID-19 infections can go up, triggering fresh new disruptions. Hence, some of the questions that arise are, is household survey at a crossroad post-COVID-19? Will the swift adaptation of household surveys at national level lead to permanent changes in the national statistical infrastructure? What are the lessons learned from countries that have implemented such changes? What worked well? What did not work well? What important elements to consider before embarking on a total transformation of national household survey programs? So our discussion today with our excellent panel will showcase these innovative approaches and reflect on the above questions. The panelists will also respond to selected questions that were raised by World Data Forum participants. I am pleased to first introduce Professor Jim Lepkowski, the first speaker. Jim is a research professor emeritus in survey methodology at the University of Michigan. He is a founding director of the program in survey methodology degree programs at the University of Michigan. Jim has extensive experience in international, national, and local survey design and analysis, with methodological expertise in many areas, including telephone sampling methods. Jim will discuss COVID-19 and the use of telephone in surveys. Jim, over to you. The floor is yours. Thank you.
Well, thank you very much for the introduction. I'm going to be talking about aspects of telephone surveys in the context of the pandemic of COVID-19. As has been noted with the pandemic, there has been great concern about the risk of infection, not only for participants in surveys, but also the staff in surveys. And the use of the telephone was raised very quickly as a way to at least continue survey data collection in the context of a global pandemic in which restrictions are being placed on personal interactions. So I'd like to talk about COVID-19 and the use of telephones in the next few minutes. and cover a little bit about face-to-face surveys, what's meant by that, what's meant by telephone surveys, and then some methodological criteria for comparison of the two, and then just a few remarks about future perspectives. So let me begin with the topic of face-to-face surveys so that we understand what's been going on in the national statistical offices and non-governmental agencies that conduct surveys globally. In the case of face-to-face surveys, the topic really should be divided into at least two parts. On the one side are the interviewing techniques. The label face-to-face surveys comes from the type of interviewing that's being done. But the type of interviewing that's being done also has a number of labels and abbreviations. And in particular for face-to-face interviewing, people sometimes talk about computer-assisted personal interviewing. They're referring to the devices that are used to aid in the face-to-face data collection, the direct entry of data on the spot by a staff person, perhaps by a pad-like device, but it could be through paper and pencil, which would be the primary mode in many surveys around the world. At the same time, one has to realize that face-to-face surveys also comprise sampling methods, how we get to the subjects. And those involve what are typically multi-stage sampling designs. And these multi-stage sampling designs involve sampling across stages, primary sampling units. They involve, for a country such as the United States, where I come from, an area sample in which for the entire country, areas, provinces, counties, smaller units are selected. In a second stage within those counties, something called a segment, a block, or a enumeration area is selected, and only within the selected counties. And then within those segments, households are selected as a convenient unit for identifying subjects who are then within the households identified and selected for interviewing. The telephone has been used in many of these survey operations to aid either the interviewing, perhaps scheduling interviews, or the sampling to allow communication between field staff and office staff to make sure that they're working in the right areas. It has not been used in many of these countries as a device for data collection. CAPI, however, computer-assisted personal interviewing, this label that gets placed on face-to-face interviewing, itself can be thought of as having indeed that face-to-face component in real places, with real people, in real time. But that does not exclude, in some cases, organizations that have centralized telephone facilities that are used to collect the data once contact has been made to do follow-up interviews by telephone. The problem in both these cases is with the COVID-19, the increased infection risk for subjects as well as staff, and that has led to the halting in virtually every country of face-to-face data collection. Even the use of pad devices has not made a difference at this point, although that can have some potential impact, but it will not eliminate the risk. So the computer assistance is a separate matter from the actual face-to-face contact with subjects. Telephones, though, could be used to reduce face-to-face contact and reduce risk by making initial contact perhaps face-to-face and doing the follow-up and the interviewing by a telephone device. But really what's been talked about is something called a telephone survey rather than using telephones in the face-to-face context. And telephone surveys, as well as in the case of face-to-face surveys, really need to be talked about in terms of two components. One is telephone interviewing, as we had before, interviewing using the telephone as the mode of communication. The telephone interviewing, though, gets combined with telephone sampling. And again, we have some specialized terminology that goes with this that sometimes gets mixed or used in replacement of these more generic terms. For example, for telephone interviewing, there's computer-assisted telephone interviewing. It's basically computer-assisted personal interviewing. The same kinds of devices, the same kinds of software can be used there, but it just has a different label being used in a telephone context. Computer-assisted telephone interviewing, many think of as being done in centralized facilities, telephone facilities where there are interviewers rotating on shifts and conducting interviews from a desktop unit, although that still poses a risk for infection for staff being in such settings. Telephone interviewing in centralized facilities can be replaced by dispersed telephone interviewing. And organizations have done this over time because they have field staff that are idled when centralized facilities become active. And sometimes they find it more convenient, more efficient, and better quality in terms of the work initially to have interviewers interviewing on the telephone from their own homes. Reduces the infection risk for staff, certainly in these particular cases. And generally, we can think about telephone interviewing as being dispersed or centralized, and dispersed does address some of the concerns that we certainly have over risk of infection. And the devices, again, in a dispersed setting would use laptop computers or perhaps a pad device, the same kind of thing that we were looking at before. On the telephone sampling side, there's a label used there called random digit dialing, or RDD, and it refers to the sampling method. I want to say a bit more about it, but it is a system for generating phone numbers in a list. Some phone systems would allow you to identify individual subscribers, but that's rare, frankly, across the world, because many phone systems are managed, run by private companies, and they're reluctant to release this kind of information. But that does occur in some countries around the world. What we see with telephone surveys, though, is a cut in the risk, a reduction. It doesn't eliminate risk, but it does reduce the risk of infection. And it was originally used in many places to reduce costs, because it eliminated the need for travel, which would be more expensive than having interviewers in a centralized or even a decentralized facility, and not having to travel to individual homes or workplaces. RDD really refers to a system of sampling methods that involves a virtual frame. It seldom uses telephone numbers themselves. There are rare exceptions, and I call them rare. They do occur in many countries, but the idea that you would actually have a set of telephone numbers that correspond to individual subscribers in a country is not the norm. An example of this would be what occurs in the North American numbering plan. So this includes North America, Canada, Mexico, the United States, and countries in Central America, south of Mexico, as well as the Caribbean, and US territories that go as far west as Guam. And it's a 10-digit numbering system that was established after World War II. And the first 6 digits of that numbering system are fixed. They are assigned to individual companies to be used in local places where they offer their service. There are no number combinations. Then what's the random digit dialing portion? Well, the random digit dialing portion is that the suffix, the last 4 digits, are generated as random numbers. Now, this is the conceptual. This isn't actually used in practice. There are variations on this that are much more efficient. But that's the basic idea. It's a sampling method that utilizes the virtual frame defined in terms of known number combinations and added random numbers. So those are the two methods, the two general approaches, the ones that have been in competition, the ones that have been halted in face-to-face surveys, and then the telephone surveys that have been attempted in some places to continue survey operations that have been halted altogether. It's useful, just to move to the last part of this presentation, to talk about 4 areas in which we should compare these two methods. And I'm going to talk about them in terms of sampling, which we've already talked about, coverage, that is the ability to include all members of the population in the samples, at least potentially. Measurement, differences in how these things collect, these methods collect data, and non-response. In any country or anyone evaluating these systems should think about these four things: sampling, coverage, measurement, and non-response. There are types of error that arise and have been studied extensively in the context of both face-to-face and telephone surveys. So face-to-face surveys with area sampling use a kind of sampling method that involve clusters. And those clusters actually tend to increase sampling variances. They make the data more noisy. We compensate for that by having larger samples, slightly more costly. As contrasted with telephone surveys, where telephone number sampling occurs, we're sampling individual elements, telephone households, although it could also be individuals with subscriptions to mobile or cell telephones. What we see is that the outcome measures, the quality measures, things called standard errors or confidence intervals, are improved with telephone surveys for the same sample sizes compared to face-to-face. So we can at least establish that telephone surveys might have the ability to have larger sample sizes because they have potentially smaller sampling errors because of the ability to sample elements directly. With respect to coverage, we're talking here about the portion of the population not covered by the survey. So in the case of telephones, that coverage aligns a frame, in that case a virtual frame in the telephone case, with a population. And population can just be thought of as a huge data file from which we seek to select individual records and study those individuals in more depth. But there's always a gap between what we have on the frame, the set of materials we use to make the selections, and the actual populations. The problem has been that in some countries, telephone coverage has been low, particularly when they were doing surveys of households directly by telephone in older technology, where households, not every household had a telephone because of expensive connections. Today, coverage can be higher than face-to-face surveys, particularly because of the use of mobile or cell phones. And so we actually see today that coverage issues are about the same when you look at them between face-to-face and telephone surveys. But still, it depends on the country, it depends on their phone system, it depends on the penetration of mobile phones, and it needs to be looked at in the comparison of these different systems. In terms of measurement, the ability to obtain answers, whether it's in face-to-face or telephone interviewing, there may be differences, or at least there were suspicions that there were differences in answers given face-to-face and by telephone. Comparative experiments decades ago showed differences were not large. Whether there are some small differences by type of question, whether you're asking about factual kinds of questions, or asking about opinions, or asking about sensitive questions. There were, in all cases, suspicions that these kinds of things led to differences between the two modes and that you wouldn't get the same results. But the results of these comparative experiences showed that the differences were generally small. So in terms of sampling, slight advantage for telephone surveys. In terms of coverage, about the same between telephone and face-to-face. And in terms of measurement, very much the same kind of thing applies. Generally, very similar kinds of measurements. Now, I'm saying this in very broad general terms, and usually when you generalize, you're wrong. So I want to make sure that it's well understood. These need to be studied not in general terms, but in the specific conditions of a given survey and in a given country. The one where we see differences has to do with non-response. Non-response rates that differ between face-to-face and telephone interviewing. That may involve refusals, both direct and indirect, people simply not wanting to participate and telling us so, or not wanting to participate and using indirect methods, not answering the phone, not participating, hanging up in the middle of a phone call. It may also involve, though, caller ID screening, people looking at a number that they don't know, coming from a government agency, they may be unwilling or reluctant to answer by telephone interview. So there's a great deal, perhaps more concern about response rates in telephone surveys, the very basic idea of calculating rate. But the rate is not the issue. The rate is not as important as the issue about non-response bias. Is there a difference in what we get by telephone with lower response rates than we get by face-to-face with higher response rates? And again, it depends on the circumstances. And so in a comparison, it is difficult to have one general conclusion here. For example, in the United States and in European countries, attitude items show little bias when there's comparisons between telephone surveys with low response rates to face-to-face surveys with higher response rates. Some factual items do show differences. But again, it's going to depend on the rate, the response rate, and the circumstances, cultural differences across countries in terms of that, how serious that issue is. All right, given this kind of context, we now have a way of thinking about what these two things are, face-to-face surveys and telephone surveys. We've talked about some of the comparative criteria we could use for evaluating these. What do we think about in terms of the future? Is this like cliff diving? Are we going off the edge of a cliff and into an unknown future? Perhaps. You know, telephone surveys are not straightforward to implement if they've not been done before. There's frame development, sometimes involving commercial vendors for obtaining lists of telephone numbers. There's modifying interviewing methods, centralizing or decentralized. Training has to be different. The staff could be the same if you're doing decentralized interviewing, but still modifications need to be made. There need to be developments of potentially new computer systems, unless one can utilize what has been done for face-to-face surveys. Although, and even that includes, instead of computer technology, paper technology can be adapted, but it still requires some development. And then attention to non-response reduction, which if going to telephones is more important than you would typically see in face-to-face surveys. So one can make transition, and it's happened. When you gain experience by moving to a new mode, generally what you find is that there's an inertia to change. People are reluctant to change once they've made all that effort in implementing something new. So what is going to happen in the future as people have started using telephones? Well, COVID-19 is not going away. I know people think that a vaccine or there's going to be some miracle cure drug, but it just does not appear at this point in time that that's likely to be the case. What we need to do and what we're doing now is understanding the risk of infection and how to adapt to that risk. And that may lead to the opportunity to go back to face-to-face interviewing with appropriate social distancing, the use of masks and other kinds of things. But it may also lead to the greater use of telephone than we've seen before in many of these countries. Possible to move back to face-to-face surveys for one day, but the use of telephones is going to persist. And that's going to be a part of the future for all of these agencies that have been adapting to this crisis through the use of telephones. Telephones, along with COVID-19, are not going to go away. They may not be a predominant mode of data collection, but certainly as staff become more and more familiar with them, they're going to be more comfortable with using them, especially as new survey opportunities come along. So I hope this has been useful to you in understanding the nature of the problem that countries are facing and some of the criteria for making comparisons. Thank you.
Thank you very much, Jim, for really this illuminating presentation. Now over to our second speaker, Ms. Ruth Steadley. Ruth leads the COVID infection study division within the Office for National Statistics of the United Kingdom. She will talk about the experience of the UK in carrying out the large-scale COVID infection survey and how the data are used for policymaking. Ruth will also cover how such experience will impact the statistical business process in the long term. Ruth, over to you. Thank you.
Hi, so I'm going to talk to you today about the COVID-19 infection survey, which we are running here in the UK. Very briefly, I'm going to cover how we designed our survey and the outputs that we produce. the impact that is having, what we've learned from doing it so far, and where we see it going in the future, and also how we think that we can learn some lessons more broadly for surveys in the future. So just very quickly, if I give you a very quick overview of what the survey is trying to achieve. So the objective is to be able to measure rates of infection of the virus and how many people have developed antibodies to the virus over time. So we are going to be measuring prevalence, incidence, and other measures over time, both at the national level, but also by breaking that down regionally and by different occupations and whether people are reporting symptoms and other additional information that we have, ethnicity and age being critical ones of that. So this is a household survey where people are invited to take part. And everybody who does take part, on a weekly basis, we have swabs from them to determine whether they currently have the infection. And we do that every week for the first 5 weeks. And then we do that monthly thereafter. So it's a longitudinal survey. And as I should have mentioned, this is the household that is sampled. So we survey then everybody within the household. Of those people that are taking part, a proportion are then also asked to donate blood so that we can take their bloods to test for antibodies. And that means that we can see if they, even if they are not infectious at the moment, they might have had the infection previously. So this is a study that was being set up in partnership with a number of partners across the UK. It was commissioned at pace and established at pace, as was many of the things to support the pandemic. So this, for example, so I believe that the study was actually commissioned on Wednesday, the 15th of April. We had medical ethics achieved by the following Tuesday, the 20th. We took our first swabs and bloods of people who were successfully accepted to the survey on the following Sunday. And our first results were shared on Friday, the 1st of May, so about a fortnight. And during that first week, we had to arrange for the survey design, the sample to be pulled, the materials to be designed. We had to go through medical and data ethics, all the data governance, as well as the logistics around print capacity, deliveries, etc. So it was no mean feat and really worked at pace. If I move on now to the analysis that we conduct. So as I mentioned, we do measure both positivity rates of the infection and antibodies, and we also measure the incidence, so that's the number of new infections. And for us, that means that you have to be in the survey as a negative, with a negative test and then turn positive. So it's very clearly new viruses in the survey. And we break that down by a number of demographics such as age, sex, etc. We also ask some questions around behaviour, so where people work, how they are travelling, whether they are using masks. And we are very mindful that these are self-reported questions and the associated points that go with them. So this is a household survey, as I mentioned, and so everybody in the household is sampled. That means that we have a real opportunity, because it's also a longitudinal survey, to understand within household transmission. And that's one thing that we are working through now, to understand how transmission is passed across generations or within the household. Our tests use a PCR test, and we use a cycle threshold of less than 37 with 3 gene targets as described there. And our tests also go for virus DNA sequencing. So if I move on to just a summary of some of our recent results. So this is just an indication of the sort of information that we published. So our latest results, which were published just last Friday, and we publish every week. We'll demonstrate the number of people testing positive. Every week we also issue these positivity rates across the different regions of England. And as I say, it just gives a little feeling for how things are changing over the time. It allows people to understand how the pandemic that they are experiencing is across the country. We are very mindful that this is one of the most robust studies to understand the virus in the UK. And actually, this is what people in society will be experiencing. Other results that we published, as I mentioned, we also measure incidence. So that's the number of people who are newly testing positive. And there on the right-hand side, we also publish this by age. So you can see there that the latest results, well, the results that are published here, but our latest results are the same, is that actually it's younger adults where the growth is most strong. And actually our more recent results actually confirm that in a much stronger way. So a variety of different ways of describing the information, which we find that our users benefit most helpfully. So these results have all been for England. We have also produced information within the UK for Wales and Northern Ireland, and they have slightly smaller sample sizes, and so the credible intervals around those are slightly larger, but over time that will increase, and we have just started the rollout also in Scotland. If I move on to the impact that this has had, this is, as I say, the key official source, which is now consistently relied on for what is happening in the general community. So our survey goes to everybody in the population, in the community, and by that, it's everybody except people who would be in residential care homes or in hospital. The way that we ensure that we maximise our output is about considering the best way to share this information. So this is absolutely critical information for government, as you would imagine, and we provide twice weekly management information for them, with some of the headline statistics, some detailed analysis on a once a week basis, and we continually respond to continuous requests and queries. We also, as I've already mentioned, publish this every single week. The data is used to support key decision making at right across government. It's used by the Chief Medical Officer, by the Department of Health, and all sorts of policymakers across the UK. We were going through a period at the beginning of the pandemic where our Prime Minister was standing up every day, giving updates, and this information was used in those slides. Again, that is happening again now with the regular updates from politicians and key decision makers. It is also used as a form of benchmarking for people and helps feed into the R calculations. You can see there from some of the pictures that it gets absolutely high media attention. So moving on to what we learn. So I think the thing that was absolutely critical here was that we stood up actually the largest UK household survey in under a week. So we refer to this being in-flight operation and design. So I mentioned earlier that the first sets of information were published within a fortnight of the commission coming in, but actually it was up and ready in that week. And we did a significant amount in that week. It required people who really knew their way around surveys, being able to work very, very rapidly, make quick decisions, but good decisions. We had to pull together a significant workforce, work very closely with our partners, and a broad set of challenges such as managing the health and safety concerns for our field force. So bearing in mind that we had to get phlebotomists to take bloods, etc. So understanding those in the situation where we were in lockdown. what was really critical as well was actually that desire to work collaboratively. So there was a collaboration across a variety of national organisations, and that desire to want to work in that way meant that we were able to continually improve what we were doing. There have been some more practicalities that we've had to face as we came out of lockdown over the summer. So during the early part of the pandemic, our samples were very much working at home, so it was very easy to access people. Situation has changed as people have gone back to work, and so we've got different challenges that we now need to manage, and we are keen to make sure that we continue to share and learn from others across the UK, but also across the world. So going forward, we have a new approach to our sample to ensure that we maximise the data that we are able to use. We have significantly increased the amount of people that we are testing, and we have now achieved a test of 150,000 people per fortnight in England, which is quite incredible actually. And so there's a variety of different points there around the different regions, but you know, it should not be underestimated the amount of people that we've managed to get into this survey. And it's really exciting that people do want to take part. If I move on then, thinking about the future. So as I mentioned, we've increased the sample size, and that is absolutely critical, because what that will allow us to do is to really focus on sub-regional estimates so that we can understand with greater precision what is happening locally. So we will be able to provide localised trends for populations of about 500,000 people. And that is quite critical. So we're expecting that to be about 100 areas within England, and that will allow us to have greater detail of the characteristics of those people who are testing positive. And then if I just move on to my last slide, thinking about what the broader legacy of this is, there is something really important about thinking how we pull together the breadth of information that we have. So this survey is, as I say, a household survey of the community population. We also have surveillance in care homes, in schools and in hospitals. We have testing in hospitals. There is work around testing in high-risk workplaces, in prisons. How do we need to consider how we think about international travellers and other at-risk, potentially at-risk groups. So there's something really powerful about thinking carefully about how we bring together all of that information and test data. And one of the suggestions that we are actively considering is ensuring that we've got a common minimum data set for all COVID-19 data. So making sure that we are always collecting the same small number of variables so that we can do that understanding and triangulation. And you know, being able then to do local surges as issues arrive. And I think my final lesson and that I would share, and the legacy that we have, is that actually this work is fantastically important. It's very important for the country, and because of that, the ability to work at pace, to push those boundaries, was absolutely astounding. The ambition of the team that did this was amazing, and I suppose we mustn't forget that. We mustn't forget the energy that we had when developing this. So when we think we have other problems in the future, how do we do this? We mustn't forget that we stood up a 150,000 person survey in 7 days. And I will leave it there. I'm sure there are questions.
We'll go to our next panelist, Ms. Wilhelmina Welsh. Wilhelmina heads the Information Management and Innovation Unit of the Joint Profiling Service. She has a major in political science and has extensive experience in data and analysis in the humanitarian field. Wilhelmina will talk to us about the sampling strategies for surveys to cover internally displaced persons, the pathway to a post-COVID new normal for humanitarian data collection. Wilhelmina, the floor is yours.
So yeah, thank you very much for the opportunity to be part of this panel today, looking at household level surveys and the potential path to the new normal. And again, building off from Jim's presentation, which was really enlightening and setting the stage for what, how things should work. I will give a couple of notes on the actual reality of how we deal with household surveys in situations that are quite complex, particularly situations of forced displacement. So I'll briefly introduce the joint IDP profiling service to you, and then give you a couple of reflections from the challenges we encounter in situations that are not the pandemic when carrying out household surveys. And then also a couple of ideas of what we anticipated at the onset of the COVID pandemic, and what that looks like for us currently when we're supporting country operations. So who are we? The Joint IDP Profiling Service, very briefly, is an interagency service between a variety of multi-stakeholder actors from the UN, governments, etc., etc. We provide technical service in terms of setting up, sustaining and carrying out collaborative data and analysis processes, building consensus around data and displacement contexts. So this is where we are coming from, and this is the experience that we've had since 2009 in carrying out household level surveys in areas of forced displacement. Very briefly, in terms of areas of our work and how we do that, we provide support to country operations that have identified a gap in terms of information. We do so by providing advice, technical advice and support. We take that knowledge and that experience. As you probably know, each one of the household level surveys or any other data collection processes is quite unique, not only in terms of the design of the actual survey, but the process itself. So we take that knowledge back up to our teams, improve the tools, integrate best practice and what we've learned from those experiences, and provide that in the next exercise. So that's just very briefly on the Joint IDP Profiling Service and how we work. Just to get to the reality of it, it's really complex carrying out timely and up-to-date and agreed upon data collection exercises, bringing together everyone. But it's even more complex in situations of internal displacement, where the operational reality can quickly shift and influence the sampling strategies, the actual data collection process, etc., etc. So what we've recently done is review the how we've actually done that in the last 10 years in different situations. So you'll be able to access that review, and it is, again, basically the main message for you from that review is that we normally deal with a really imperfect situation and have to adapt and be good enough when we carry out sample-based household level surveys. But there are 3 or 4 things that are really key that we sort of carry from that experience, and that is really being a good documenting and being really transparent about the approaches taken, and secondly, being really thorough and thinking really about the linkage between the objectives of the exercise, what are the information needs, and how they're translated into information and data requirements in the actual survey. Finally, being able to spend enough time to map out the target populations, do the specification of the survey in a way that will reflect the complex reality on the ground. So with those lessons learned from these experiences, and we have a lot of examples provided really going into the specific sampling approaches chosen for those situations in the document. But there are 3 areas really of focus that are also influencing how we think about the new normal. And that is really a focus on the specification stage, not only mapping of target populations, but really spending time in designing those surveys in a way that will cover gaps, but not overburden the context. We do that by focusing on the information landscape mapping, understanding what data systems are available, what data they provide, and how we could be, how we can make sure that we're interoperable with those systems. And finally, delivery of remote training where necessary, and you'll see more about that in a second. So just to show you a little bit of an example of what that actually practically means, this is an example from Somalia where we've worked and are currently working with counterparts from the government and the international community there about designing and using sort of the information that's available and adding information on internal displacement in durable solutions, which will feed directly into the monitoring and evaluation chapter of the National Durable Solutions Strategy. So what you see here is really that preparatory work on understanding the information systems that are already in place, the type of data they're delivering, really going down to the indicator level and seeing how we can actually design and design a survey that will cover those specific gaps. So the new normal, what did we think about, or what was the anticipated, what were the anticipated changes at the onset of the pandemic? You can also find this document on the DIP's website and read a bit in more detail. But basically, it really builds upon the challenges that we saw now. The first one, so I'll just go through a few of those quick assumptions that we made at the beginning. And we really want to emphasize that lean design aspect. We will have to think a lot more strategically if we haven't done that at this point, but even more so because of the pandemic, about the design and analysis of the questions we need to be answered through those surveys. That is a key aspect that links back to setting the proper objectives of the exercise, etc. We really need to make use of the secondary data that's available there. So all of the aspect that I just mentioned about mapping the information landscape, understanding what systems are delivering, what types of data and how we could be complementary, and what is already there is really key. Acting as a documentarian, especially now during the pandemic, and as we hear from other speakers, there are changes in place and we have to adapt. We have to think about setting up different systems. It's really important to capture those changes, to really understand who is being left out of the systems that we're designing, and that understand that all of them will be somewhat prone to different biases. So reducing bias, documenting bias, and being really cognizant of those elements will be key going forward, regardless of how we think household level surveys will change. As the previous speaker highlighted, shifting from face-to-face to remote technologies is not something we can rush. We see that already in many different ways, particularly for populations like internally displaced people. The baseline data that we have in order to set and create a sampling frame is very often outdated. It really is something that changes very quickly when populations are mobile. Finding the right corresponding phone numbers, for example, etc., is an even more complex endeavor. So if we want to do this right, we cannot rush the shift, and we'll have to really focus on designing purposefully with the capacities in mind that exist and with the challenges that are real in terms of operational challenges, such as mobile populations and outdated registers. Finally, focusing on community engagement can really bring about a very important or complement some of those gaps that I just highlighted. So we really have to emphasize community engagement in those data processes and capitalize also on other types of data like thick data. Not to throw around terminology here, but really making use of other types of data that are available to us to complement where we might have gaps using imperfect, to some extent, household level survey approaches. So those were our assumptions at the onset of the pandemic. And what does this look like currently for us, where we're operating? I have two very brief examples, and what you see here is just a sort of a slide of the JIP's profiling advisor discussing with the technical group in Mexico, including government counterparts and civil society, who were pretty much ready to start the exercise in November 2019, and then the pandemic hit. And we realized very quickly that to make even a shift of remote modalities to meet, collaborate, and discuss and prioritize aspects of the exercise was difficult. Not all government counterparts were free to use their email outside of government premises or had stable internet connection at home. So we had to really shift into breaking down this process into smaller bits and pieces, into bilateral virtual meetings, and really also invest in JIP's capacity to design and lead those remote discussion possibilities and training opportunities. So this is just one of those examples where now, based on this preparatory work, based on the remote exchange and sort of that compartmentalization of discussion, it's been possible for the collaborative platform to prioritize one of the states in Mexico for the upcoming IDP profiling there. Similarly, one exercise that is sort of going forward right now, and it's a household survey that is going to be implemented under the Peace Building Fund in Sudan, covering a large geographical area, quite complex with regards to sampling approach. Here, the focus has also been on those three areas that I mentioned before, really on the specification stage and the mapping out of the information landscape, looking at the complementarity and the smart and lean design of that survey, including elements of remote training for those that will be carrying out and continuing to train and carry out later on data collection when possible. I'll stop here, and I look forward to your questions.
Thank you very much, Wilma. Much appreciated. Really interesting to see how these things play out on the ground, as you mentioned. So now we turn to Ms. Riaza Fatima, who's our last speaker. Fatima Riaza is the Deputy Statistician at the National Bureau of Statistics in the Maldives. She is the head of Population and Division Statistics. Riaza will cover the experience of her office using the data on COVID-19 to inform policy in the country. Riaza, the floor is yours.
Yeah. Thank you, Papa, and thank you for this opportunity. Let me share my screen. So let me first start by thanking Papa and UN Women for giving us this opportunity. And today I will be talking about one of the key data collection exercise that National Bureau of Statistics has carried out during this pandemic. And presentation is actually focused on the impact of COVID on women and men's economic empowerment in Maldives, which was a study we conducted together with UN Women. So, but I will briefly touch upon how the survey was implemented and how we partnered with different agencies, but my main key talk today will be on how the results from the survey has been used for policy planning and at different levels in the implementation of different programs that we have carried out. So to start off, let me first state that the first case of COVID in Maldives was reported on 7th March. And since then, the government, especially the government agencies, has been working from home. It was early April that UN Women reached out to us to be part of the global survey, which they were carrying out to assess the impact of COVID on women's and men's economic empowerment. So when we first received the invitation, we were actually at the time discussing on how we within the country should be gearing up to do different rapid assessments that were urgently needed. We were getting many requests from multi-sectoral agencies in the country. Even the UN agencies wanted to do several rapid assessment surveys in the country. So we discussed the initial request we got from the UN Women with the relevant stakeholders and agreed that this is a good opportunity for us to look at how the COVID is impacting the economic empowerment of women and men in the country. So since the survey by UN Women was designed in a way that we had to share a link through SMS to our mobile subscribers, that was something which was new to us. I mean, we are a small country and it was something new to us, and we had to first organize ourselves on how we are going to implement this survey. So what we did was we first reached out to the telecommunication authority in the country, and with their help we were able to get the telecom companies on board with us for the survey. They were quite willing and partnered with us, and we were able to share the link with our mobile subscribers, and it was sent to about 500,000 subscribers, which is like more than the population in the country. So then next came the rollout stage of the survey. In order to launch the survey, we also felt that it would be useful for us to have the survey, the questionnaire translated into our local language, and we did it together with UN Women, and we carried out the testing phase of it. The survey was launched on 22nd April, which was the third day into complete lockdown in the country. When that's when the first case of local transmission of COVID was reported in the country. So if the coordination at first, it was a bit difficult, but we were able to coordinate with both telecom partners, and the coordination between the two telecom partners, I would like to say, was very good, and they launched the survey on the same day. So, but I would like to highlight at this point is that even though that we could not go for face-to-face survey in the country, this provided us a new avenue to explore and see how surveys can be carried out in the country using sharing links and going online and filling out the survey forms and etc. And we even from our side carried out promotional activities on Twitter, social media, and just to increase the response, even though we got a good response at the initial stage. By the end of the first week, we had close to about 4,800 response. And next, the analysis, after 1 week, we kind of closed the survey, and the UN Women carried out the analysis of the survey from their side. But the working files was shared with us, and we were able to do some of our own analysis from the findings of the survey for our internal purposes as well. So when presenting the findings, the weights was applied to correct for the sex, age difference, age and educational differences in the data that was collected. When it comes to the results, we actually started the dissemination as soon as the results were shared on UN Women's website. The results, we used our main NBS platform, which is our Twitter, our Facebook, as well as our NBS website also. We even shared the findings of the results with our interagency working groups on gender statistics, on CRBS, and even the health committees we have. We even shared the link with the report findings with our statistics coordinating committee and with the UN agencies also. Following the kind of dissemination, that since it was only online dissemination, we were able to do at that time. We got some request from the different agencies requesting for reference documents regard to the surveys and other related household surveys we were doing in the country. So what we did was we created a special link on our website where we had all the COVID-related studies that were being done in the country, and we have included the findings of the survey as well. The findings from the survey was also discussed in different webinars we have organized, and we even joined UN Women in the launch of the global report as well. For the policy use, with regard to the data that was produced, I would like to say that it was very much needed to assess the current situation in the country at that time. When we look at the areas which the women in the country was working, most of them are working in the informal sector, and the findings from the survey highlighted, many lost their jobs due to the COVID, and it was a concern which was actually taken up at the policy level. So due to this, the findings from the survey was actually referred, and government has had to find ways in how best to provide income benefits for those working in the informal sector. The results from the survey also highlighted the mental issue and the violence against, not the violence against, but more specifically the mental issue, health and other health problems that was increasing due to the lockdown in the country. And the survey gave us an idea on how the situation was among the population. The findings has been quoted in different webinars and publications and policy documents, and I think one of the recent one which I can quote is the World's Health Mental Day that we just marked in the country. The World's Population Day was one of the other major activity that we carried out, and this year's Population Day theme was centered around putting brakes on COVID, how to safeguard the right and health of women and girls. So all our promotions for the day was centered mainly on the key findings of the survey. This included like us preparing a short report on the findings, as well as we prepared a 3-minute video which was shown on the public media, highlighting the issues that was coming out from due to COVID in the society. We had a ministerial webinar which we planned for the Population Day, and the issues highlighted in the report was discussed at the great length by Minister for National Planning and Minister for Gender, Family and Social Services. So we were happy that we were able to do something which was being used at a policy level at this moment of time to address certain issues which were faced in the country. One of the other things which I would like to highlight is that President delivered his address on the occasion of the World Population Day, and in his address also the issues which was highlighted from the survey was also he highlighted the key issues which was among the key findings in the survey also. The other work which we have been able to do since the survey has been launched and we have the findings now. One thing which I would like to highlight is that we have been getting a lot of requests from different multi-agencies for carrying out rapid assessment surveys. We have taken the initiative in providing technical assistance to some of these agencies, while with some others we have partnered and carried out data collection, and one of them has been for a survey which we have done for the construction industry. We have done for the tourism sector, because in Maldives we are really dependent on the tourism sector, and since the closure of the border and with the COVID situation, we have been hit really hard, and since it's our most income generating activity, we wanted to look at how the tourism was affecting its employees and things. So we used the same methodology which we applied for the UN Women Survey, and we passed out SMS especially to those islands which was located. We used that cell tower data and send out the messages to islands which was located near the resorts. So in that way also we tried to reach out to the tourist employees and get their feedback on how they are, what are the challenges they are facing due to the COVID situation. Since we were playing a main role in mainstreaming the data collection, and this provided us actually a good opportunity to play a key role among different sectors for the data that they were collecting during the pandemic. So we worked out certain data collection methodologies and how best to approach different subjects with regard to data collection, and we were able to work with the COVID socio-economic research team and tried not to repeat some of the key areas which we have covered in the UN Women Survey. But of course, there are cases where the information was much needed, and it kind of enriched the data collection, having all this information in one survey as well. So what I would like to highlight is that the results are being used very much right now in the country, and it's we are happy that we got the opportunity to partner with the UN Women and do the survey at an opportune time as well. So when looking at the how we are planning to move forward with the future data collection, even during this pandemic, what we have learned is that this pandemic has given us a good opportunity for different stakeholder agencies to work together, to work in solidarity, and it has like kind of highlighted the importance of having timely, reliable, and relevant data for decision making when it comes to the population, when it comes to women, when it comes to elders, as well as on children. So as NBS, as the main statistical agency in the country, we are continuing our efforts to collect data on different aspects with regard to the impact of COVID on the population. And one such service which we are preparing right now is to do a COVID-19 assessment on households, which we have interviewed in the household income and expenditure survey, which we carried out late 2019 and early 2020. So for this, we are preparing to go for phone interview. And again, this is the first time which NBS is taking the initiative to do such kind of data collection, and how the response rate is going to be is something which we are looking forward to. And since it is something new for us, we are right now establishing the necessary IT infrastructure which is needed for us to carry out the phone interview. And Maldives, again, being a small country, we are very much limited in our capacity, and we depend on our technical supports provided by other development agencies and partner agencies as well. We, in the meantime, are preparing for the census 2021, which we are planning to carry out in the later half of 2021. So since due to COVID, many of our census preparatory activities has been delayed, which includes doing the census pretest, pilot, and even GIS mapping exercise to have the GIS maps ready for the census. So right now we are looking at alternative ways in which we can conduct the census. And if the current situation continues into the early half of next year, what are the possible ways that we can conduct the census in the country? Apart from that, we have also done a survey on looking at how the COVID is affecting the small businesses in the country together with UNDP, and we are hoping that this partnership will continue in the future as well. So with that, I would like to end my presentation and look forward to answer any questions there is. So thank you.
Thank you very much, Riaza, and certainly the pleasure was all ours working with you. And again, I would really like to thank you and your excellent colleagues for the collaboration. So again, thank you very much to all of the panelists for really a really interesting conversation. Just quickly and briefly, I would like to just ask a quick question to all of you before we wrap up. I would say, what do you think? Do you think that some of the swift adaptations of household surveys at the national level will lead to long-term changes in the national statistical infrastructure. And again, you've all talked about some of the important elements that you've learned, but would you say, what would you advise countries to think about? Basically, one key element that you would like to advise countries to consider before making a total transformation of household surveys. So maybe we start from the last speaker, Riaza. Given that you are in an NSO, what would be your take on that?
Thank you for the question. Let me first start by saying that the COVID gave us the opportunity to explore different ways of collecting data in the National Statistical Office. We, like in Maldives, we have very much been dependent on doing field work, training enumerators and sending them out to the field, visiting households and collecting data. We were we all these years we collected data using paper questionnaires, but with our recent household income and expenditure survey, we have been able to move to CAPI using tablets to collect the data from the field. But with the COVID situation, what we have learned is it's not the only way that we can collect data, but using internet as well as with the mobile telecom companies is also one way we can continue collecting data at a household level. But the question remains is how much of a response we might get if we are to employ such kind of data collection methods in the future, whether we might get the same response rate that we are getting right now in future, and how well are we penetrating into the to the most vulnerable communities in trying to gather the most of these informations from them as well, because different surveys are targeted for different population pockets of population, and whether these are the best ways that we can reach out to them. But we are willing to explore these possibilities and move forward as well. And one of the first steps that we are taking in this area is to conduct a phone interview in our next data collection exercise. And we would be more than willing to share our experience with regard to this as well. In the meantime, we are also exploring other ways of presenting data as well right now, which is the use of big data, using the call records as well as using the Facebook records also. So these are new opportunities that has been presented to us, and we are very much willing and ready to explore these opportunities for us as well. And I think in the meantime, many countries, especially different NSOs, are also working towards doing household surveys with this regard through online application and through phone interview, as well as conducting census online as well. So I mean, it would be a good opportunity for countries to share the lessons they had learned with regard to COVID with regard to COVID and the challenges they faced in data collection. But we have definitely for us, when we implemented the UN Women Survey, worked well for us, and it depends again on how well it move forwards in the future. So thank you.
Great, thank you very much. And I think the Intersecretariat Working Group on Household Surveys obviously can really play an important role in really distilling what those lessons are, and also I think collecting information from countries as part of our COVID task force work. So Wilhelmina, same question to you.
Thank you, Papa. Not an easy question, I would say. I think the last so this year has been. I think the pandemic has given an opportunity to highlight two aspects that GIPS is particularly committed to. One is collaboration and really having a collaborative sort of collaborative process around data, and that starts way longer. That starts really quite a long time before designing actually and carrying out the household level survey. It starts really with everything that I highlighted, with having these discussions beforehand, with really discussing the objectives, with having really time to design, you know, the survey with that purpose, and not rush things. In humanitarian and development settings, things are often, you know, quite quick, and we need the information now, and we need it. But in order to invest, so I think the pandemic has been an opportunity for us to really engage with stakeholders, with governments, with international community in that particular way, and also basically advocating for two things. What we engage with the expert group on refugee and IDP statistics, which includes national governments and NSOs, to review how data on internally displaced and of course persons and refugees can be included in national censuses and other large household level data initiatives. So there'll be a process of rethinking there and how to do that. And sort of, I think we can use the time that we have now and the lessons that we learn and sort of a bit of a break in planning to do so. That's what we are going to be doing in the next sort of year and year and a half and two coming ahead. The second aspect here is also really about resources and investment into, if we want, and I think this is my main point, if we want that shift, I think it's okay and it's possible to do, you know, smaller scale phone surveys and experiment a little bit with, you know, with sort of with internet surveys, et cetera, but in most contexts where we work, that requires a real investment, as our colleagues highlighted, in capacity and infrastructure and understanding coverage. And so I think it will give us an opportunity to actually think about more longer term investments and potentially, you know, again, collaboration when it comes to building panels, if we're looking into panel studies and more longitudinal work and studies. And I think that is an opportunity right now to slow down and discuss together and decide on those more longer term.
So Ruth, same question to you.
So if I consider in more detail the legacy that we've got from this, for me, it is about that ambition. So there was a group of people, and I wasn't actually here at the time, but there was a group of people who absolutely knew that they could do this if they were able to partner with the people who they also knew could do this. And so there was that collective energy. And so we had a number of really expert people who had been managing surveys for many years, who were able just to stand up this household survey because they understood the minutiae of the different parts of the process. So whether that is developing the sample design and the methodology that underpins it, whether that is about understanding how to develop survey respondent materials, whether it's about thinking what is the best mode of collection, working in partnership with people who were experts at medical ethics and standing up research studies very quickly. Pulling together the right set of people absolutely made the difference. And the benefit that we have got by the Office for National Statistics doing this is, of course, we are independent. And so we're able to press ahead in a way to provide those independent statistics.
Developing and learning about new methods and how they work in their own context, and then learning from other people.
And then thinking more about
who can learn from them as
the
well.
Collaboration and what I think you asked about
thank
advice
you very much, Jim.
to other
really,
countries.
I think, you know, a nice
I
way
think
to...
my answer relates to my last slide about ambition again. But we all know that within our statistical systems, we have quite delineated processes. And at times you have to push against those boundaries and think, will this work for me here? And if not, what do I need to do to make sure I can answer the question that is on the table? How What do I need to do that ensures I can provide the most robust estimate for how many people are testing positive? And you make your system fit what you're trying to answer, because you've only got a very short period of time. So the one thing that I have learned is that you absolutely have to take everybody with you and work really, really collaboratively in partnership, but be very, very clear about the goal you're trying to achieve.
Great. Thank you very much. Jim, over to you for the final word.
Thank you. I just wanted to say that I think Wilhelmine is right in terms of this is an opportunity to explore the potential of alternative modes and ways of conducting surveys. And Riaz has given us a good example of the things that she's been involved with. If I look back on my own career over the last 40, 50 years, where I actually started out doing telephone surveys as one of the first activities in my own organization. And it provided an opportunity, an inspiration for my career. And I think the same thing is going to be happening for the young people and the staff who are facing these kinds of challenges. This is a great opportunity for people to really grow and develop new methods and improve the methods that they're using. More importantly, though, I think it's also an opportunity for there to be a global connectivity on these kinds of methods. So these things are not being done in isolation. What is going on now in many of these countries that have not had to face these kinds of issues because they've had very stable systems through face-to-face interviewing is that they need to explore alternative modes. And that's been happening in other places already. And there's an opportunity to learn both ways. The people who have been doing work on mixed mode surveys and dual frame surveys and all sorts of other kinds of designs facing different challenges. It wasn't COVID-19, but other kinds of challenges with respect to non-response or coverage, those kinds of issues, have learned some lessons. But their lessons are limited in the context, in their own provincial context of where they've had to operate and what they've done. And this is a great opportunity for us to expand our understanding of how these things work globally. And so a coordinated effort through the United Nations or others, through some kind of secretariat to bring together people who've had some experience doing these kinds of things with those who are learning to do them, I think would be a wonderful outcome of the opportunity. And thinking about this, it's been depressing to think about what's happened with COVID-19 and the data and the stop of the information flow, the things that are so critical to many countries and efforts. But it does represent an opportunity that I think, I hope we can take advantage of in terms of what's going on in these countries, people growing and developing and learning about new methods and how they work in their own context, and then learning from other people who can learn from them as well.
So this brings us at least this session to an end, and I would really like to thank all of you for your interesting discussions, for your contributions. And just I think there are I think a couple of points that came out for me, and one is obviously I think something that all of you have mentioned, the fact that we are learning lessons, right? So COVID, I think, has forced us to push the boundaries in terms of how we collect data and what data we collect, and to start basically, I think, a learning process. And if we go back to to the title of the session is Household Survey at the Crossroads, the answer is yes, obviously, because there are lots of new things that we are learning. And this learning can be done by sharing information, sharing lessons, particularly documenting them and sharing them. And I think the Intersecretariat Working Group on household surveys, again, can really play a role in this area, because that is, after all, also, I think, the value added of the United Nations, which is bringing stakeholders together, learning together, and distilling the lessons and sharing them back to the world. So I look forward to working with as co-chair of the Intersecretariat Working Group, to work with members and with countries to really start documenting these lessons and sharing them.